Understanding neuronal ceroid lipofuscinosis, NCL. Neuronal ceroid lipofuscinosis, also known as Batten disease, is a group of genetic neurodegenerative diseases. Batten disease most often affects children, and is considered the most common childhood neurodegenerative disease. It presents in 2 to 4 in 100,000 children worldwide. Batten disease is categorized into 3 main types: infantile, late infantile, and juvenile Batten disease. The average age of onset for infantile Batten disease is from 6 months to 2 years, late infantile Batten disease 2 to 4 years, and juvenile Batten disease 5 to 10 years. The disease is caused by a mutation on a CLN113 gene, and has an autosomal recessive inheritance pattern. Both parents must carry a mutated copy of the gene for the disease to be passed down and present in their child. CLN genes encode enzymes needed for normal lysosomal function. Without this enzyme activity, cells cannot properly remove waste, causing sugars, proteins, and fats to build up. This buildup damages neurons, which affects central nervous system activity. The only way to confirm a Batten disease diagnosis is through genetic testing to identify which gene is mutated. Batten disease is incredibly devastating for the patients and their parents. Children may be reaching developmental milestones normally until the onset of the disease, at which time, the symptoms progressively worsen. In the early stages of the disease, children will often exhibit personality and behavior changes, or movement and coordination difficulty that they did not previously experience. Over time, common symptoms include seizures, a loss of vision that eventually leads to blindness, and cognitive decline leading to dementia. Sadly, in the end stages of the disease, the child will no longer be able to function independently. The current prognosis for Batten disease is poor. All diagnosed patients will have shortened lifespans. Today, most available treatments are targeted at symptom management. For instance, anticonvulsant medications may be prescribed to minimize seizure activity. Physical therapy and speech therapy can help the child maintain as much mobility and language use as possible. Despite the current outlook, scientists and medical professionals work diligently each day to advance knowledge that can inform treatments for Batten disease. These new therapies mainly aim to delay or slow the progression of the disease. Recently, promising advances have been made in small molecule, drug therapy treatments. One enzyme replacement therapy, cerliponase alpha, is approved to help slow disease progression in patients with the CLN2 gene mutation. These treatments target the core problem in Batten disease, the buildup of waste materials within the cells. Another ongoing experimental treatment is gene therapy. This treatment uses a delivery vehicle, like a viral vector, to introduce a working copy of the CLN gene into the central nervous system to replace the mutated one. These experimental therapies have shown to successfully slow the decay of neurons and brain matter, and will continue to be advanced in the future. While much progress is being made, the variability in gene mutations makes Batten disease difficult to diagnose and treat. To meet these challenges, new diagnostic tools for genetic diseases offer ways to help practitioners increase diagnosis accuracy. In the future, technology may also allow for individual treatment plans for each patient. Increasingly, emphasis is being placed on prenatal genetic counseling to help parents understand their risks when conceiving, or at least allow for early disease detection in children. Efforts are also focused on understanding how to best support patients and parents during this difficult time. Batten disease is a devastating diagnosis, but the scientific community is making unprecedented progress. As research continues to advance, the hope for an effective treatment or even a cure grows stronger each day.